Hi, my name is Stephanie Williford. I'm the CEO at EB Medicine. I hope you're enjoying your emergency medicine practice subscription. If you're a print subscriber, your first issue is in the mail and on the way to you now. Print and online subscribers can also access all of our content anytime from your computer or mobile phone. Let's take a tour of one of the issues. When you're short on time, start at the back. Our Points and Pearls section summarizes the key points and takeaways for each issue, so you get the must-know information in just a couple minutes. You can also browse all of our Points and Pearls summaries by visiting ebmedicine.net/PNP. When you're ready to dive into a full issue, you'll find it's chock full of practical, evidence-based recommendations you can use on your next shift. We follow a consistent format each month, so you can quickly find the information you're looking for. Each issue starts with case presentations and a critical appraisal of the literature, so you know the quality of the evidence for the recommendations in the article. If you flip to the back, you'll also notice that the most important references are noted by an asterisk, and all references include information about the type of study and number of patients, giving you additional insight about the evidence. After the appraisal and a brief overview of the epidemiology, pathophysiology, and etiology, we then discuss the differential diagnosis, ED evaluation, and diagnostic studies. This mirrors the process you follow when a patient presents to the ED, and the article focuses on the practical aspects that will impact the care of your patient. A subscriber favorite, of course, is the treatment section, where we present an in-depth review of the evidence for the treatment modalities for the topic. We also discuss controversies and special circumstances and populations, as always focusing on the practical takeaways. Another fan favorite is our risk management pitfalls. Presented as excuses that don't work in court, these will help you avoid costly mistakes in managing your patient's care. And lastly, each issue also includes at least one clinical pathway, which gives you an easy-to-follow algorithm for patient care. A unique feature of our pathway is that they include the level of evidence for each recommendation. Many of our subscribers use these as the basis for protocols in their ED. And that's a wrap. With emergency medicine practice, you get practical, evidence-based clinical pearls in less than an hour a month. We hope you enjoy every issue. Be sure to also check out the corresponding podcasts for each issue and to claim your 4CME credits, all of which are included in your subscription. And remember that there's a wealth of knowledge you can search and access in our archives. Thanks for subscribing.